One of the blood tests we did when you came to hospital was something called the HbA1c. You will hear us talk about your HbA1c a lot because every time you come to clinic we will check one. The HbA1c measures how much glucose has been hanging around in your blood for the past couple of months. There is always some glucose in your blood, and glucose sticks to your red blood cells. Once the glucose is stuck on, it can't unstick. The lower your blood glucose levels are, the lower your HbA1c will be, and this is important because if you have high blood glucose levels for a long time, this can cause serious problems with your health when you are older. These are called the complications of diabetes. This table shows you what you should be aiming for with your HbA1c. When you are first diagnosed, your HbA1c is always very high, as you will have had high glucose levels for a while, but soon the level will fall. We are aiming for your HbA1c to be below 50 by the time you have had diabetes for 3 months. We know that your risk of complications is directly linked to how long you have had diabetes for and how low your HbA1c is. We know that if you get really good control early on, it can help reduce the chance of you having complications. The main diabetes complications we worry about are eye damage, kidney damage, nerve damage, and also heart attacks and strokes. With eye damage, it used to be that the commonest reason for young adults to go blind was because they hadn't looked after their diabetes. From the age of 12, you will have a special eye check every year, once a year, to make sure that there aren't any changes due to diabetes in your eyes. If they are picked up early, they can be treated and sorted out. The commonest reason for kidney failure in young adults is diabetes that hasn't been looked after. Again, we start testing for that from 12 years old. Once a year, we send some of your wee off to check if your kidneys are working properly. With nerve damage, if your nerves are damaged because of diabetes, you can't feel pain properly. This means that you can have a cut on your foot, but because you can't feel pain, you don't know it's there, so it can then get infected and cause all sorts of problems. Heart attacks and strokes are more common in people with diabetes, and this is why it is really, really important that you must never, ever smoke. Smoking makes you more likely to have a heart attack, and if you put smoking and diabetes together, then you have a very, very high chance of having a heart attack. If you are overweight, you are also more likely to have a heart attack, so it is important that you keep your weight at a healthy level. We will also keep an eye on your blood pressure once a year to make sure this is normal too. Finally, as we have explained before, diabetes is what is known as an autoimmune problem, where the body's immune system gets confused and attacks itself. If you have one autoimmune problem, then you have a slightly higher chance of another one coming along as well. This is why you will have a blood test once a year to check that all the other parts of your body are working properly. Look after your diabetes well, keep a healthy weight, have regular checkups and blood tests throughout your life, and don't smoke. If you do all these, you should live a long and healthy life.